Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Today, we'll be talking about haemoptysis. Be sure to subscribe and click on the bell icon for more awesome content. Haemoptysis refers to coughing up of blood originating in the lower respiratory tract. It can range from a bit of blood-streaked sputum to a more significant amount of blood. This is distinct from haematemesis, which is actually blood originating from the GI tract. You should be comfortable in taking a haemoptysis history, as not only is it a common OSCE station, but it is also a common respiratory presentation. Haemoptysis can indicate a common illness, such as a common cold, but also point to something more sinister. When taking a history, consider causes such as infections, bronchitis, pneumonia, tuberculosis, chronic conditions such as COPD and bronchiectasis, malignancy such as lung cancer, vascular issues such as pulmonary embolism, arteriovenous malformations, and other causes such as autoimmune diseases and trauma. Be sure to ask about red flags in haemoptysis presentations. Red flags such as the duration of the haemoptysis, how much blood is lost and how often, any other associated symptoms such as weight loss, night sweats, fever and chest pain. Smoking history and occupational exposure is also important. So here's a history to demonstrate that in action. Hi, my name is Camille. I'm one of the ACPs of the practice. Can I start by taking your name and date of birth, please?
Of course, my name's Alan Nicholson and I'm 67 years old.
Nice to meet you, Alan. So today I've been asked to take a history from yourself just because you presented with some symptoms of coughing up blood, is that right?
That's right.
So do you want to tell me a little bit more about that?
Of course, it's really worrying. This has probably been going on for the best part of about 2 weeks now. I've been coughing, and within the coughing episodes, I've noticed some blood.
Okay.
And it's not small amounts either.
Okay, I'm sorry to hear that. Yeah, absolutely, that can be a worrying sign if you've noticed that. Is this the first time this has ever happened?
I've never had this before.
And when you say blood, is it fresh red blood?
It is, yeah, fresh red.
And is it every time you cough or is it just intermittently?
It's not every time I cough. I would probably say in a day it at least happens once, but it's fresh red and it's mixed with my sputum.
Okay, and when you're coughing up, is there anything else in there, for example? Any other weird colours, yellow, green?
Not really.
No, okay. And it's the first time it's happened, you've said?
Yeah.
Is it getting worse as the days are going by, or?
It's staying much the same, like I said, at least once a day. I do cough a little bit anyway, but I'm just worried that it's not going away.
So when you say you cough anyway, is it a long-standing cough, or tell me about your cough a bit more?
Well, I've been coughing for months or even years.
Oh, really? Okay, so is that something that's normal for yourself, or is that?
I guess you just learn how to live with it, really. It hasn't affected anything else in my life.
And with this cough, are you having some shortness of breath symptoms as well, or?
I have become a little bit more short of breath.
Okay.
I think that stops me from walking around, doing the gardening or anything like that.
And are you sure it's coughing of the blood and not, so for example, vomiting of the blood or anything like that?
Definitely not vomiting. Don't feel sick or the need to be sick. It's just when I cough, I've got blood.
And I know it's difficult to quantify, but when you cough up, is there tiny specks of blood or would there be like quite a significant amount of?
It's either streaks or everything I can see with spit is basically covered in red.
Okay. And have you had any chest pain associated with this?
No chest pain.
Okay, all right. And while you've been going on your normal activities, you say that it has affected some of them because you're feeling more short of breath recently.
I'm definitely feeling a little bit more short of breath, but that's over the last few months. I feel very exhausted. I just feel tired.
I'm sorry to hear that. So quite a lot of symptoms there that you've described. What about things in addition, such as weight loss or anything?
I have to say, I think I'm losing weight, I must say, because my trousers are getting looser.
And when was that first apparent?
I think over the last few months.
So similar sort of timeline?
Yeah, of course, with the blood at the end, or right now.
Okay, so and consider other things such as your general well-being. You say you are getting about. Are you still working at the minute?
I've just retired.
Okay, and what was your line of work?
So I was a warehouse operator.
Okay, fine. And in terms of yourself, other ways, eating and drinking?
Otherwise, I'm eating and drinking all right, yeah.
You know, in terms of any fevers you've noticed recently?
No fevers.
Okay. What about things like your bowels and your waterworks?
They've been absolutely fine.
Okay. And apart from, you say, this cough that you've had for a couple of months now, this haemoptysis, we call it, coughing up of the blood for the past 2 weeks. You've had some weight loss that you've noticed for the past couple of months as well. Is there any other sort of signs? So for example, any skin changes, that you've noticed?
None, no skin changes.
Any other symptoms such as dizziness, faints, anything like that?
No, not dizzy, not fainting, thank God.
Okay. Have you noticed any, while you're sleeping, that you're waking up drenched in sweat?
No, nothing like that.
Okay. And any pain in your lower legs, either side?
No pain and no swelling either.
Okay, that's perfect. Have you had any recent travel as such?
No, it's been quite some time, I'm afraid.
Okay, brilliant. So I'll ask a little bit about your past medical history and some other questions as well, if that's okay.
Of course.
Have you got any diagnoses that you see your GP or your hospital specialist for?
Yeah, I've got type 2 diabetes.
Okay.
And I've got high blood pressure.
And how are those both managed?
Not too bad. I don't go to hospital for either of them. And I'm told that my diabetes and my blood pressure are well controlled.
Perfect. And do you take any medications for either of these conditions?
Yeah, I do. So for diabetes, I take metformin.
Okay.
And something called glycoside.
Okay.
And then for my blood pressure, I just take something called amlodipine.
Okay. And you take those regularly?
I do, yeah, every day.
Okay, perfect. So in terms of your social health, have you had any surgeries, anything like that?
No, nothing at all.
No, okay. And in terms of yourself and your family history, have you had any significant, with your parents or your siblings, any significant medical history that you want to tell me about?
Well, my mum's sister, so my auntie, she died of unfortunately cancer, but we're not really sure where that was.
Okay.
But aside from that, everybody's been okay. My parents eventually died of natural causes.
Okay. And what about in terms of yourself? Do you currently smoke?
I do.
And tell me a little bit more about that. How many do you smoke a day?
Pretty naughty like that. I probably have about 40 a day.
40 a day, 2 packets a day.
2 packets a day.
It must be expensive, that.
It is. There's ways around that, I guess.
Okay. And have you always smoked 40 a day?
I have, as far as I remember. It's just a habit, and in those days it was all right.
And have you tried to stop, or is that something that you've not really considered?
Too late in the day to stop, I think.
All right. Well, that's an alternative conversation, because your health can always improve no matter what age you think about stopping smoking, but we'll circle back to that. Do you drink any alcohol?
No.
No. Okay, brilliant. And you say you're quite active still. I know you've retired recently, but do you go to the shops? You're able to walk around, do your own chores?
Yeah, I'm enjoying the outdoors, doing things like going out with the grandchildren and also gardening.
Okay, brilliant. And was there anything you were worried about particularly today?
I can't help but get worried at the fact that I've got blood in my sputum. I don't know what's going on. I thought, have I got an infection? Do I need like antibiotics?
Potentially, yeah.
Is there something deep, dark going on?
What I would like to do is take some routine observations. I'll check your blood pressure, temperature, etc., and your heart rate. I'd also like to listen to your chest with my stethoscope.
Of course.
I'll probably refer you to a few different things, if that's okay. I think we need to get a chest x-ray here. The reason being, some of the symptoms that you've described can lead to more sinister causes.
Like?
So, for example, you've got a long smoking history. We want to see if there's anything going on within the lungs. So, are they okay? Is there any pathology in there? Pathology meaning, is there any infection that we're not seeing? Is there any, you've said you've not traveled recently, but things like TB we can pick up on in chest x-rays, and also more serious things such as, unfortunately I have to tell you this, cancer as well.
So you are thinking that?
Potentially some of the symptoms you presented with, shortness of breath, the blood in the sputum, that's quite worrying. Okay. So as part of this, I will initiate something called a 2-week wait referral. Now what this will do, this will fast track your application for the chest x-ray and potentially being seen by a lung specialist as well.
Okay.
Just with some of these symptoms, we don't want to hang around and wait longer than needed.
I don't want to hang around either.
Yeah, and sometimes time is of the essence with these things, as you're well aware.
I'm really worried, and I'm just really worried now.
I know, I can appreciate that. We'll do our best to, answer any of your questions today, and of course, keep in touch with any developments, and we're happy to support you.
Thank you.
Do you have any questions for me apart from what we've discussed today?
No, you've been very helpful. Thank you very much.
So you'll receive a letter within a date for the next couple of days for a chest x-ray and also for the appointment with the chest specialist.
Thank you very much.
Thank you.